everyone. I've got the coveted right after lunch slot, so I'll try to keep this interesting. So we are Recovery Plus, the home-based cardiac rehab company. So what I'm going to talk to you briefly about today is where we've come from, where we are today, what we're doing, and in fitting with the mission of HitLab, what our forecast is for 2024 and where we are going. So, quick recap. Telehealth, the explosion of telehealth really changed our business model starting in 2020 when we saw three key things happen. Patient acceptance was, of course, driven by the pandemic. So patients realized that this was the only way they were going to be able to see their provider. Healthcare professionals started embracing telehealth in greater numbers, realizing that it was, in fact, good for their patients. And then the third thing, very important there, and I'll touch on this a little bit, reimbursement. The attitude towards telehealth reimbursement was loosened to allow telehealth coverage. In fact, the stat there from February to April of 2020, the number of telehealth visits went up by 78 times, which sounds like a huge number, but many providers, of course, weren't seeing patients at all. So a little bit about our world, a little bit about the cardiac rehabilitation. This is about telehealth for chronic care management. So cardiac rehab, it's effective. If you were here yesterday, you heard Dr. Boujri, who's our medical director in New York, cardiologist and a heart attack survivor, say that cardiac rehab saved his life. It's effective. It's also safe. It's administered by healthcare professionals, and you're monitored while you're undergoing cardiac rehab, so it's effective and safe. And the third unfortunate point, it is also wildly underused, with only about 20% of people who should be on cardiac rehab and reap the benefits actually participating and staying on therapy. Rather than go into all of the numbers behind that, and there are a number of issues, I thought we'd do a quick example today and talk about New Mexico. We got an inbound lead, if you will, from New Mexico a few months ago. Very promising business opportunity. And so as we do when we're moving into a new state to grow there, and we are a nationwide program, we look into practicing medicine and getting reimbursement. We've actually found the bar was pretty low in New Mexico. They really need healthcare professionals. And when you look into it, there was a great article in the Albuquerque Journal that laid out just why. High medical malpractice premiums, about 3 times the rate of neighboring states, were causing doctors to just leave. Low Medicaid reimbursement, so added high costs with low revenue opportunity, not a good recipe. And then you add on to that a high tax rate, taxes on medical services, which are pretty atypical. So a lot of doctors were just simply leaving, looking at you, Colorado and Arizona, to much more attractive neighboring states, to the point where there are now 146 practicing cardiologists in New Mexico. And if you think that's correlated with low access to cardiac rehabilitation facilities, you would be absolutely right. If you're getting cardiac rehab in New Mexico, you are almost certainly getting it from a telehealth provider, you're getting it virtually, and you're getting it from a provider who's out of state, in our case, Texas. So that is the situation. When you think about, and by the way, just touch on that, New Mexico, if you'd expect to know what their participation rate is, the nationwide participation rate in rehab is 20%. New Mexico is about just a little over 10, so half the national average. Telehealth is not one way to get care for chronic conditions like this, particularly in rural areas. It's the only way. Our patients, the Recovery Plus patients, their option is nothing. They just don't go to care. So, the question becomes, does it work? Can you deliver care like this effectively to patients through telehealth? So again, rather than go over a slog through the data here after lunch, thought we'd illustrate it with a few examples. We conducted a clinical study this year that just wrapped up. We'll be publishing it in the first quarter, and yes, it does work. But it's a lot more compelling when we hear from the patients. So this is Jill. Jill's here in New York, very interesting lady. We came to meet her during the height of the pandemic, so really telehealth was the only way to connect. And Her attitude was fearful of overexertion and not sure to get started. We see this all the time. Our patients are fearful. They don't want to do anything. They just had a heart surgery or a heart attack, and they're worried they'll have another adverse event. I didn't think I could exercise at all, said Jill. My EP checks my blood pressure and heart rate regularly, reassures her that the treatment is appropriate and that she is safe. And you can see the jump from I didn't think I could exercise at all to it is invigorating and I feel better. Here's another great example. So this is Lenore, very energetic lady, who when we came across her, she had a heart attack and said, I was mentally exhausted and I had a hopeless feeling. Her words, I was ready to give up. There's a good video of Lenore, about a 1-minute testimonial on our website if you want to see her in action herself. But that's a pretty strong statement. I had a more positive attitude about everything after just a few sessions. And really this is maybe the most striking quote to me in all of our patient testimonials, of which we have many. It gave me the energy to interact with everybody in the family, especially my granddaughter, who is the joy of my life. So again, went from I'm ready to give up to the joy of my life. That's a pretty significant improvement in quality of life. Here's Glenn. Glenn's an interesting fellow. He really likes being a patient ambassador, a patient testimonial. So Glenn has some high-risk factors, and he travels a lot. His doctor told him he really needed to take better care of his health, and then he said, I had not done much of this until it was recommended to me by the doctor. So it took a lot of cajoling to get him going. His schedule is very challenging. So we created a program for Glenn that allows him to do his rehabilitation. It's more preventative care for Glenn, anywhere he was. For most of our patients, the equipment needs are minimal, if not nothing. So it's not particularly difficult to administer them. He can do this in his hotel room, hotel gym, outside, or at home. Again, completely home-based, the evaluation and the administering of care for Glenn. And again, you can see the difference. I had not done much, and now down at the bottom, this is just a few weeks later, I'm getting fit and starting to feel muscles I didn't know I had because they hadn't been used for so long. Finally, I'd like to introduce you to Erna and Bobby, also here in New York. So Bobby came to us because his doctor referred him. He had a stroke, unfortunately. He's also has Parkinson's disease. So Bobby was definitely in need of rehabilitative care to become active again. Erna has got some risk factors. She's got some health issues, but she was not eligible for rehab per se. So we've got Bobby on the treatment now, and Erna we have in our preventative care program. I'll talk about what that means shortly. And again, you can see there, Bobby found out he had a stroke. Both of them were very worried. Erna was very worried about her partner, and now you see the result here. I'm so fortunate to have Bobby participate with me as we both benefit and encourage each other. So they do go through the program together, not at the same time, because they do have very different exercise protocols. So that's just a few quick examples of patients. That's what's happening today. That's what we're able to do now. There are some challenges, there are some potential solutions, and we've got a lot of optimism about the future. So some of the challenges. So eligibility for cardiac rehab is very tightly defined. Right? According to Medicare, there are 1.3 million people eligible for cardiac rehab in this country. That's despite the fact that there are 6 million ER visits due to heart events every year. So they're obviously missing something. It's very narrow. We actually present ourselves as a remote patient monitoring company, which is why we were able to take on people such as Erna, who we just saw, who's technically would not be eligible for traditional in-person cardiac rehab. There's also a lack of coverage for many chronic conditions. This type of treatment is well known to help with pulmonary recovery, long COVID sufferers, and there's several studies that have shown the type of approach that we use at Recovery Plus has lowered remission rates in cancer patients. So there's a whole host of things that we could be treating successfully if we weren't so limited by Medicare Part B. There's a limit on the number of sessions, technically, in cardiac rehab, which just, if you've ever been in an exercise program, just doesn't make sense. You don't go through an exercise program and then suddenly you're done. You find an exercise program that's appropriate for your needs. Hopefully it's enjoyable, hopefully it's easy to do so you stick with it, and it requires a lifestyle change that is forever. And finally, during the public health emergency, reimbursement for telehealth procedures was loosened by Congress. That loosening is technically due to expire at the end of next year. So I'm not sure if we're going to go back to where we were. And in a perfect world, we wouldn't. We wouldn't. What we'd love to see is codify coverage for telehealth sessions so that they're all covered. Expand coverage of preventative care so that we can take people into programs like this who have risk factors, right? The goal of cardiac rehab is defined as reducing hospital readmissions. The goal of preventative care is not to eliminate the second hospital visit, to eliminate the first. That's really what we want to go after. And finally, redefine rehab to remove the time constraints and the end dates on a program that's keeping you healthy and keeping you out of the hospital. Important to note that all of these things, all of these changes would reduce healthcare costs. It would reduce ER visits. The average ER visit in this country costs $2,500. ER visits frequently lead to ICU stays. The average ICU stay in this country is $19,000, and longer stays, of course, can skyrocket from there. So, if I just summarize all of this, I'd say there is no telehealth care and health care. There's only health care. Stop differentiating between the two. They're both effective. So that's what we're looking at in the regulatory environment. This puts the challenge on us. This puts the challenge on the providers. What's the onus for us? What are we doing? I showed you some examples of what we're doing with patients. What are our plans going forward? How can we improve, given this environment, this perfect world regulatory environment? Well, we can improve efficiency through the telehealth care tools that we use, always improving them, always making them better, and increase the number of treaters who are actually able to connect with patients. In that New Mexico example, if we weren't able to connect treaters in Texas with patients in New Mexico, they simply wouldn't get care. So increase the efficiency and improve the treaters. Personalized care, this is very important. We have, in our program, we have athletes, younger athletes who've had a heart event, all the way up to more older people who have had a heart event or are really limited in what they can do. It's not the same program. It's got to be personalized, and the personalization is only getting better. And finally, the three-part process. In our program, it's basically cardiac rehab is the exercise recovery program. Nutrition and diet is a critical part of that. And as you saw from our examples, mental health. There is a strong correlation between having had a negative health event and depression. So we need to be able to incorporate all of those things, the diet, the exercise, and the mental health into one holistic treatment of the entire patient. So this leads us to the last point, 2024. We're very optimistic about 2024. A lot of great advances have been made. We're proud to be responsible for some of them. A lot of great companies out here who are taking leaps and bounds. As we tried to summarize all of this, we realized that there really are three main trends, and they're all related, one going to the other. Personalized risk assessment and stratification, really figuring out what the risk factors are for the individual patient and devising a treatment plan that can mitigate that risk. Stratifying, putting patients into risk groups and figuring out how we can keep them from being admitted to the hospital. Dynamic treatment plan adjustment, really having a plan that evolves as the patient's health situation gets better or regresses, which happens in some cases. Always adjusting the treatment plan to mitigate risk and to keep patients on a track to a positive health journey. Finally, down at the bottom, bullet number 3, so this gets into population analysis. We have a lot of patients, we have a lot of patient data, and predictive analytics with the rise in the use of sophisticated analysis, artificial intelligence to analyze reams of data, we can start to apply predictive analytics for outcome optimization across wide populations. So In conclusion, and I know I'm right at time here, so I'll thank you for listening and say, really the goal of chronic care management and telehealth is delivering effective and tailored interventions for recovery and prevention for all health conditions across all patients, whether you're in New York City or New Mexico. That's the promise, and I know we're all on this journey together. So thank you for listening. My name is Peter Niemi, and that's my time.